We're chilling with High, Wellness Wednesday. And today we're going to be talking about medical marijuana. In this book that was written by Lisa Brooks and published by the International Publication Company, or Publications International. So thanks to them, Wednesday. Benefits of THC. Anti-inflammation. It's anti-inflammatory properties that have made increasing popularity. THC has been known to shrink cancerous tumors in laboratory animals and prevent cancers from getting bigger. It's obviously got the dopamine. We know that. Increases the appetite. We know that. That's what gets the munchies. It eases the mind. We know that. It's got CBD and the benefits of CBD. And before cannabis was labeled an illegal drug, it was extremely common for people to have their drug in the medicine cabinet. In fact, prior to the Marijuana Act, Tax Act of 1937, the most common way to consume cannabis was in tinctures. Today, tinctures and other cannabis concentrates are making a comeback thanks to the ease and the convenience. And there are plenty of different concentrates to choose from cannabis oils to CBD oils to waxes. They even got balms where you can rub it on your skin. Effects. Since everyone's body is different, everyone's high is different when using medical marijuana. Some people feel euphoria, relaxation, and others feel anxious and paranoid. We also know that it helps with hunger. That's where the munchies come in. That's where your CBD2 receptors are found, and that's more found in your body. And that's going to help with the anti-inflammatories that we talked about. It's also going to help with the THC produces a hormone called ghrelin, which is the hunger hormone. Thus, it's called the munchies. And there's different cannabis. Sativa versus indica. Sativa was first cultivated near the equator in Thailand, Mexico, and Africa.
Okay, you said smell on the border.
Popular sativa strands include Durban Poison, Strawberry Cough, and Amnesia Haze, saving it. We also have cannabis has indica. Indica has traditionally been grown in parts of Southeast Asia. It says, from seed to smoke, cannabis can either be grown from a seed or from stems taken from mature plants. Does the species matter? Yes, it does. The effects. What effect do you want? That's why I've got to get my blend right, my daily blend. I like 80-20, but it kind of does a little bit too much. So I'm thinking 70-30 sativa to indica for the daytime, and then nighttime is just pure, if I can find it, 100% indica. Because I just want to be able to shut the brain off and veg. Because when I go to sleep, it's tough. So Brooks, is she alright? Once you've decided to try treating your pain with cannabis, finding the right method isn't as easy as rolling a joint and puffing away. As with any medication, dosage and monitoring for side effects are both very important, and with thousands and thousands and the millions watching and thousands of strains of cannabis to choose from, finding the one that's right for you can take a bit of trial and error. Do some trial and error. Medical cannabis, French cookie, welcome to Wellness Wednesday. Chillin with I. So it treats Crohn's disease. It helps with multiple sclerosis, as we know, because it affects the receptors for pain. So anything with pain, like MS, maybe like chronic knee pain, migraines. So as we know, it helps with pain. The higher the CBD, the better the pain. The higher the THC, more euphoria you feel. Put it that way. For the different things what marijuana could help, it talks about what cancer, and then why would marijuana help it. It talks about like ADHD and why marijuana would help that. For me, it's my chronic pain, not only for my stomach issues, but my congestive heart failure. And it also helps with my post-traumatic stress syndrome or depression. As we saw, there's different kinds of methods, from oils to rubs. There's some that's got all CBD. It talks about just all those. It talks about how your mind can reset, how it's not really. It is an addictive personality because it takes, throws out the opiates, but your body doesn't go into withdrawals if it doesn't have it. Now, your pain will increase because obviously if you're smoking medical marijuana for pain, it's going to increase back up because there's no masking. Your CB2 receptors are not overacting. They're not bouncing off each other and trying to mask the pain, I guess, if you want to use it in layman's terms, is what I come up with. But it definitely helps me. It helps me, and not only, it definitely helps me for insomnia if I get, I smoke my indica blend that I got, and we do have one coming in today in Missouri. They're just waiting on supply. It seemed like last time I checked, and I will be checking on them and maybe even visiting with them and see if I can get more information and get you guys more information about medical marijuana. All right, so this has been Chillin with High, Wellness Wednesday. Today we went over the medical marijuana book pamphlet that was written by Lisa Brooks and edited by Ian Fiegel. So thanks, guys. As they wrote on the back here, medical marijuana is sweeping the nation. The taboo surrounding marijuana is being lifted, and the medical benefits of this plant are now outweighing the supposed dangers. With medical marijuana, learn the breakthrough research that is changing how the nation is looking and treating this once highly restricted substance. So this has been Wellness Wednesday. episode 2. Thanks again. Until I see you when I see you.